old age automatically causes stroke. That's not true. Many young Africans in their 20s and their 40s are now having stroke due to hypertension, due to smoking, due to stress, obesity, diabetes. So age only increases the risk. It doesn't actually cause stroke.
Hey, God.
So here are 10 myths about stroke or neurological conditions that people have, but it's not true.
Let's have it.
True. Number one is that old age automatically causes stroke, which I've told you that it's not, because stroke is in the brain. It's a problem with the brain.
Are you kidding me?
It can happen at any age if the lifestyle or medical risks are present. What you need to do regular checkups, do exercise, always measure your blood pressure if you're someone that has high blood pressure. All right, it's not age limited. Okay. Myth number 2 is once movement returns after stroke, it means you are fully healed. It's not true.
What are you saying? What is he saying?
Early return of movement doesn't mean complete recovery, because there are other factors like the coordination, the strength of the muscles, and the ability to control those muscles when moving. It may still be poor. Many patients walk or move with compensations. They are moving one kind. They are compensating for the absence of a particular movement. Do you understand? It takes months of constant rehabilitation for full recovery with good coordination, good balance, and good confidence. And that's what physiotherapy does.
Well.
And myth number 3 is that physiotherapy can't help stroke after 6 months.
How?
That's not true. Because the brain remains capable of change through a process called neuroplasticity long after 6 months. Recovery may be slower, but improvement is still possible, even years after. Many Africans stop therapy, too early because of this myth. They lose potential recovery. Any stage after stroke, you can still benefit from physiotherapy. What you need is consistency and repetition, because then the brain will retrain pathways that you need to relearn. It's like relearning the movement patterns it has forgotten. And these things take months, years probably of rehabilitation. Imagine having that result versus just giving up. Nah, you don't want that. So myth number 4 is that people who shake after stroke are possessed. That's not true, man.
They think they are sensible and they keep on making mistakes.
Nah, man. Nah, what we call that shaking is called tremor or spasms. It's involuntary movement of the muscles, They are neurological symptoms, nerves and brain. That's what causes it, not spiritual symptoms. Do you understand? Wow. So if you go to treat it spiritually alone, you'll be wasting valuable rehabilitation time when you should have been addressing the real problem early enough via medical science. What physiotherapists will do is, first of all, relaxation. They teach you relaxation and then controlled movement technique to regain control of your muscles that are moving involuntarily. So it's a neurological sign, not a sign of possession. You understand? And then myth number 5 is that a stroke on one side of the body means that the other side is safe forever. That's not true, because if you have one stroke on one side of the body, it actually increases your risk of having another stroke of the other side. The same risk factors like high blood pressure, diabetes, poor diet still remain. So without lifestyle changes, a second stroke can easily occur on the opposite side.
Hey.
Prevention is something that you do for life. Control your blood pressure, stay active, eat healthy, and manage your stress. Physiotherapists will always educate their patients on secondary prevention. Recovery, it doesn't mean that you are immune to a secondary stroke. So you have to pay attention to the preventive measures you've been told. Then myth number 6 is that shaking a paralyzed hand or leg helps blood to flow back. Come on now. Shaking or hitting a weak limb. All those things traditionally, you can dislocate the hand, or you can cause swelling. It doesn't help blood flow. Movement must be controlled and purposeful. Aggressive handling increases spasticity. That's muscles will become tight and stiff, and that's what these traditionalists are doing. But with proper active and active assisted exercises, improved circulation is sure. What we do, physiotherapy, is we, of course, positioning, stretching, and gentle mobilization to prevent stiffness. The best blood flow comes from guided, rhythmic movements, not by shaking. And myth number 7 is that once the speech has returned after stroke, that you don't need therapy anymore. I mean, stroke affects more than speech. It can impair thinking, it can impair your balance, it can impair your memory or your coordination. Speech may return before functional movement, but stopping physiotherapy early, it prevents full neurological recovery. Typically, full rehabilitation includes both speech therapy, cognitive retraining, and physical rehabilitation. And physiotherapists work on movement and endurance, not primarily speech. Do you understand? There is more to stroke beyond speech. Myth number 8 is that stroke can't happen to young people. Really?
Shut up, you!
More Africans that are under 40 years are now having strokes due to uncontrolled blood pressure, stress, alcohol, and poor diet. In fact, even genetic conditions like sickle cell disease can even trigger stroke in young people. So thinking it's an old people's sickness, it delays awareness and prevention. Anyone can have stroke if the blood flow to the brain is interrupted. That's the root cause of stroke. Young people need regular BP checks these days, exercise, and even balanced diet. Strokes is no longer about age, it's about lifestyle and risk control. It never really was about age anyway. All right. Myth number 9 is that only herbalists can cure stroke.
Use your head, my friend.
Herbalists may prevent or relieve pain, but they can't repair brain tissue or restore lost function, which is the root cause of stroke. In fact, many traditional mixtures are even unregulated and unsafe. How do you know the dosage? Herbal treatments alone, it delays hospital care and even reduces your recovery potential.
What is this saying?
Yes, that's correct.
So stroke requires urgent medical care to restore blood flow to the brain. Physiotherapy, occupational therapy, medication are all evidence-based treatments. It means that these treatments have been proved and confirmed according to evidence to be effective. So herbs may support wellness, but rehabilitation restores function. Okay? Myth number 10. Doing therapy every day will cause nerve exhaustion.
Get out of here, man. Shit, I'm saying.
No. The brain and muscles don't wear out from exercise. They relearn through repetition. Why? Because exercise is controlled. It's time bound. It's specific. Okay, you are not just saying I'm doing exercise. No, the physiotherapist planned your exercise and placed you on the right exercise to do. All right, so physiotherapy should be moderate, frequent, and guided. Muscles need rest, but daily gentle practice helps faster recovery. Okay, so physiotherapists plan schedules that balance intensity with recovery. Do you understand? So yeah, and that is that. Remember to like and follow and subscribe, and I will talk to you soon. And if you have any topic you would like me to talk about next, put it in the comment section and I will talk to you soon. Please share this video with your friends. You don't know what great impact you're making when you share these health tips with your friends, because it's when the heat is down, when the real chips are down, you'll know that people do what they already believed to be true when the heat is on. But when you enlighten them like this, then you change their course of action for good. All right, and remember to subscribe if you've not subscribed. Please support us by subscribing, and that's how we can grow our channel.